Hey, Jen.
Hey, Dana. Hi, everyone.
Welcome to Hypnosis.
And beyond.
Today we have the pleasure of interviewing Carolyn Schmidt. She is a registered massage therapist, breathwork practitioner, and meditator.
Hello, Carolyn. Welcome.
Hey, Jen. It's good to see you.
Great to see you too.
Yeah,
Thank you.
welcome.
Hi, Dana. Nice to meet you.
Nice to meet you.
So, I have had the pleasure of knowing you for a very long time. And when
Sometimes a pleasure, sometimes a pain.
never a pain. But when we first met, you were this incredible producer. And we had this
Mhm.
love of like healing, and we'd go to the health food store and we were sort of into yoga and whatever. And then
Yes,
somewhere along the line, you got into being an RMT and a breathwork facilitator and all of these wonderful
that's right.
things. So, could you just give us a backstory about how this all took place?
Oh my gosh, so much backstory. I had been a television and documentary producer for many years, and I worked on a lot of programming that was science and technology, and some that was deeply psychological and about understanding why we do what we do. And um, I did a lot of interviewing with a lot of people, and just I found it really rewarding. And when COVID hit, of course, everything kind of came to a stop, and there wasn't a lot to do, and I was really bored. And there was an opportunity for me to go back and learn something I had always wanted to learn. When I was making the decision about whether to go into journalism school or become a massage therapist, I went down the journalism school path, and I felt like this was an opportunity to see what the other path held. And I found a lot of similarities, particularly in interviewing and trying to understand somebody's story, where they're coming from, why does it hurt? What hurts? Um, I think when we go and we make an appointment for care, I think we have an idea in our head of what we need, but sometimes when we show up in someone's office, it can be really hard to talk about it or to find words to describe it. And so all those interview skills that I honed over many years became really important. And I got to kind of supplement that with a lot of information about the body and how things work and why they work the way they work. And when they're hurt or when they're out of balance, why? And how can we bring somebody back to balance?
Wow. So I remember when we were friends like 20 something years ago, you were really into like cranial sacral therapy, and you were really good about going to regular appointments to check in with
Yes.
yourself. So,
Yeah.
like, would you recommend going to an RMT on a regular basis? Is it something that you'll get a referral from? Like, how does the relationship start?
Yeah, for sure. So let me start by saying I think one of the reasons I was so good at going to those appointments is because I was in a lot of pain. I had chronic tension in my jaw, my neck, my shoulders, and I just couldn't find a resolution for it. It always hurt. And so I love your outside view that I was good at going. My inside view is definitely why do I need to go see these people all the time? And it was definitely because there were some parts of my body that were really out of balance, and some parts of the way that I was living that were really out of balance as well. So I needed to go frequently, and I needed to find that practitioner that could help me. Um, and so that's what I encourage people to do is find your practitioner. It might be an RMT, it might be an acupuncturist, it might be a Reiki healer, it might be a chiropractor. We all kind of innately have this ability to feel comfort with a specific kind or maybe more than one kind of therapy. And regularly attending that, especially in the beginning when you're trying to come back into balance, is really important. And most practitioners will be able to say, hey, come 6 to 8 times for the first month, once a week. And then after that, let's see how it goes. And honestly, that can feel like a lot. Because I don't know about you, but I'm doing the math in my head and I'm like, oh my God, that's like $1,500. And how am I going to do that? And um, we shouldn't be maintaining that level of financial commitment and time commitment for a long period of time. When your practitioner says, hey, come for once a week for the next 6 weeks, what they're doing is they're trying to interrupt a pattern, a pattern of holding, a pattern of thinking, a pattern of the way that you move your arm or your shoulder or your head and your neck, so that a new way is possible. And once you've found that new balance, you should be able to maintain it for longer periods of time between appointments. I know as RMTs, we also give people home care. So we want to give you the tools to be able to maintain that balance that we found together or that pattern that we've interrupted at home. And that's what the home care is for. I think a lot of times I've been given home care, maybe other people too, that I just couldn't do. And maybe it was physically achievable, but mentally I just couldn't do it. Or maybe there was some unprocessed emotion in there, so I just would avoid it. Um, so I would say if you're in that position, it's time to talk to your practitioner again and say, hey, I'm just not doing it. Um, and hopefully they're able to get curious with you about why. Because we don't need to um, put more pressure on, oh, well, you really should, isn't really very helpful. But we can be curious about like, oh, okay, so like what aspect of it feels hard? Is it how long you have to do it? Is it painful? Is there no place for you to do it? Or do you feel like you're not doing it very well? So then we can be curious with you about how to do it so that you can maintain that care between appointments and you're not stuck in this kind of financial and time commitment that you're not really up for. Yeah. If you're
Right.
not progressing, it's just time to switch.
So it's not just about laying on your table and getting a nice massage and having someone else, take away all your troubles. Because I mean, that's the thing with
Sometimes it is.
sometimes that's nice, right? But with hypnosis, it's the same thing. It's like, you kind of have to both be engaged, the practitioner and the client. So, when you walk
Yes.
away from the table, there's things that you need to do, right?
Generally, I would say yes, that's right. But sometimes the work is to be gentle. Sometimes the work is to be held. Sometimes the work is to experience touch that is comforting and safe. Um, and sometimes that's enough.
I guess depends on the client, like what they're needing and that kind of thing. It's just
Yeah,
assessing
and
each
that's where
person.
communication between therapist and client is so important. It's really important to establish how much is too much and what does too much mean. Um, as RMTs, we're given a pain scale, but we're often not really communicating what's bad pain. What is bad pain, right? What's good pain? And there is a difference between good pain and bad pain. But I think because for a myriad of complicated reasons, many of us believe or have a belief that we need to push through, and the reward will be on the other side. That we've got sometimes a jumbled relationship with what good and bad pain is. So,
Right, yeah.
establishing a communication where it's really clear to a patient, hey, this is helpful pain and this is unhelpful pain. So that you can, yes, be gentle, but also still be effective.
Mm. Could you give us an example of those two
Sure.
differences?
So have you guys had a massage and it feels a little good and a little bad?
Yeah.
Yeah. So that's good pain. Feels a little good, feels a little bad. Um, we think of that as therapeutic pressure. It's helpful. When we get into pain that feels more than good and bad, it feels a little more like pain. Um, it feels kind of helpful and it doesn't last for very long. That's often also mildly therapeutic or quite therapeutic. But when that pain lasts for a long time and it stops feeling helpful and you start to sweat and you hold your breath and you start to brace against it, it's no longer helpful. When you start to brace and hold your breath, you're locking all the muscles down that hopefully uh, there's being an attempt to open and loosen and create more functionality in. So if you're locking them up because it hurts too much, and I'm trying to unlock them, we're just in a tug of war.
Mm.
So I also give patients like a word they can use rather than say stop or that hurts, because I think we don't feel great about saying that. Do you? Is it easy to say stop?
That's true. We're Canadian.
Don't do
Yeah,
that.
exactly.
It's a little scary. So oftentimes I'll set up with a patient. We have a pain scale. So I described to you a level 3, 4, and 5. And a lot of times therapists will just say 5 is ouch, please stop. So I'll say if we hit a 5, you don't need to tell me to stop. You don't need to tell me it hurts. You can just say that's a 5. A lot easier, weirdly, to say that's a 5 than to say please stop.
So I have a question about an athlete who is getting pain
Yeah.
as they're trying to get to the next level of their progression with their body.
Sure.
Muscles have to tear, right, to grow?
There is muscular breakdown. Tearing a muscle that's torn is injured. But
I'm sure I'm
micro
using the
tears,
wrong word.
micro
Yeah.
tears do build. I get what your meaning is there. Yeah. So they do, in order for them to build a little bit.
So how do you manage somebody who is, regularly pushing their muscles past a sort of normal usage, if you will?
Yeah. Well, yeah. So I'm going to say, like, the bulk of people that I see are not sports people doing that. But the bulk of people I see are also pushing themselves past. I see a lot of nurses. They are marathon runners and Olympic weightlifters, basically, right? They're high achieving people pushing their body really hard. Um, and the first thing that you need to be curious about with anyone who's high performing is what's the balance in the body? How's their body doing? Um, we're machines, right? So even Steven's great. So if we're always moving like this and both sides are perfectly even, awesome, right? But if one side's slightly off, then all of a sudden one side's doing so much more work and the other side sometimes stops being functional. Even odds which side will become less functional or hurt. Um, it just depends on which one is actually working harder to do the same thing. It's like a teeter-totter. Even is even, but if one side's up and one side's down, which side's out? Well, they're both out. So we need to bring the body into balance by addressing any dysfunctions in the way it moves or the way it's aligned. And RMTs can help with that. And once we start approaching more balance, which might mean stretching out one side of the body and strengthening the other side of the body. Once we achieve that balance at home and on the table, then things just come back into natural, more comfort, less wear and tear. But we also just generally want to do tissue maintenance. Beyond creating balance, we want to make sure that we're doing tissue maintenance, that we're ensuring there's good blood flow, we're ensuring waste is being removed, we're ensuring that the muscle is not tight and static or in spasm. And also that there aren't sometimes people get little lumps of tissue in a muscle called a trigger point. And so we help release those again, just to help functional balance.
Let me ask one more follow-up on
Sure.
that, and that is, how much can you tell with your hands versus the interview? You've definitely emphasized how important the relationship is for you to interview your patients.
Yeah.
But and everybody's body's going to feel differently and all
Yes.
that. But how much can you tell in general? I know everyone's different. How much are your hands communicating to you what that person needs?
Yeah. So from the time I greet you in the waiting room, I'm looking at the way your body's moving. So I know by the time you sit down in my chair how your body moves. So you've kind of given me a little information before we chatted. Then you're going to tell me a little bit about your perception of how your body's moving and what the discomfort is. And then I'm going to feel with my hands, I'm going to see with my eyes, I'm going to hear when I touch your body what's going on. So there's like our hands are critical. And when I first started the program, they said you put a piece of hair under a piece of paper and you can feel it. And by the end of the program, you can put 25 pieces of paper down and you'll still feel the hair. So you get very good at feeling what's underneath. And it's a wonderful technical skill. And it's beautiful to be able to kind of touch someone's body and really find that muscle, that thing that's upset. Unwinding it requires consent, information, understanding if that's the thing the patient actually wants unwound, understanding the way they're breathing and walking and moving. What my hands feel is kind of like that typical tip of the iceberg, right? It's all the stuff underneath that's creating this symptom that we need to be curious with and gentle with and try to unravel.
Wow. I know that you do breath work as well. So how does that,
Yes.
are you doing that right now with your clients, or can you tell us a little bit about
So
that?
RMTs are not permitted to do breath work
Oh,
with
okay.
patients. It's out of our scope. But I do breath work separately. I don't advertise them together. I don't tell the same people this is what I'm doing. Um, for me, there's a intersectionality in that the way we breathe often can create comfort or discomfort. And there are a lot of complicated reasons that people alter the way they breathe. So if I said boo, you might go, that's all I mean. That's an alteration in your breath pattern. Now, some people have a frightening experience and they get kind of stuck here. And that's how they breathe. And the shoulders might come down, but they still primarily only breathe up here. And these are just three teeny little muscles that were not meant to help us breathe every day, but they're pulling up our first and second rib best as they can to help us get just a little bit of breath. And it creates a lot of chronic pain all through here and can through here. It's really our diaphragm that and our ribs, the muscles in our ribs expand and contract like this. But we sit down a lot. And so when we sit, our ribs get a little more close together, they get a little approximated. And those muscles get a little weak. And we start to rely a little more up here, maybe a couple of the ribs up here, and those skinny little muscles in our neck as well. And it makes it painful. And sometimes people get pains in their sides, and sometimes they get pain here, just from that low, shallow, but upper body breathing. Um, and on a deeper level, all the fascia in our neck, it's called cervical fascia, kind of dives down, connects to our diaphragm, all of our ribs, and then dives down and connects to our pelvis and dives down and connects to our low back. And so when we breathe, and if you've ever seen a newborn breathe, you can see this. there's this huge pumping action, and it's kind of like this ongoing beautiful fluidity and all of the muscles and all the joints of the body, and everything's getting all this juicy movement. I'm not sure if you've heard the phrase motion is lotion, especially for our joints. When we move them, they get synovial fluid moving around, which creates a little bit more synovial fluid draw. The body makes more, and we just feel a little bit more comfortable. So that cervical fascia, which is kind of influencing almost everything, when we start to get very shallow breathed, low breathed, or start to have breathing dysfunction, it just stops moving as well, which means a whole bunch of other things stop moving as well. So breath work is this kind of opportunity to sustain a natural, unhindered pattern of breath like we had when we were born. And as we try to do that, we will bump up against the pattern that we're holding. And then two things can happen. We can get a little freaked out and we can double down on it. And that's going to create a host of symptoms that your body's going to start looking for resolution for. And we'll come back to that resolution in a second. Because the other thing that can happen is the reason that we got in that dysfunctional pattern, the boo, or the I'm just going to make myself really small and safe, whatever it is, will also present the unresolved emotion that is in the pattern that's being held will simultaneously present. Now, if you are very lucky, I was not, when I started training, it'll just come up and pass. You know, you'll go, oh, I've met this physical pattern. Oh, it's got this mental relationship. Oh, that's really interesting and fascinating. And I'm just going to breathe through it. And it resolves. That wasn't my experience. I would meet, I would push, and I'd get really invested in holding on to it. And I'd get really uncomfortable, which was perfect because in the discomfort, I sought a resolution. And at some point, the body just goes, ugh, this is actually harder than holding the thing, whatever the thing was. I'm just going to let this space open up. And it opens up, and you're presented with relief from that mental holding pattern and relief from that physical holding pattern. And you get back into that unhindered breath, which then pumps your whole lymphatic system, and you have a massive lymphatic drain through your whole body. And it feels great.
So can you show us? Can we do a little
Yeah, I mean,
demonstration?
sort of. If people are watching this and they want to try it, they should lie down.
Okay.
Because you do get often a little lightheaded. Um, and you will start to notice things pretty quick. It has a really quick onset. Some of the people that I've worked with have also said that's like the most stoned I've ever felt in my entire life. So it can have that slightly altering effect. I think of it as like, have you ever gone out to the forest in the fall,
Mhm.
right? And you can see all these little spider webs and all these little things. In the spring, you couldn't see them, but you could see the flowers kind of pulled this way and weeds pulled that way. But when the first frost comes, all of a sudden you can see the spider web that's pulling it over. That's kind of what it's like. We're just changing the temperature a little. You're just going to see what's already there. Does that make sense?
Is it similar to what I experienced with my kids, Mita and Sebastian, when we did the breathwork facilitation?
Yeah, it's the
Okay.
exact same.
Because
Yeah, yeah.
yeah, it was just interesting because, when you talk about breath work, it's like, oh, we're just going to lie down and breathe. And it's like, no, it was very
And then it's
interactive.
like,
And yeah, it was work, like you had to
it is
participate.
work. And it's surprising how much work it is to do something so simple as breathe. Like I always jokingly say, like, come breathe, no experience necessary. Like we breathe every day. But breathing an unhindered breath means we have to meet all of the places and pieces where we're holding stories in the way we breathe. And that can be a fright that we have had, that can be a sadness or a grief that we're holding, it can be a protectiveness that we're holding. We have to meet it. When we breathe this unhindered breath, or when we try, our body is forced to acknowledge those areas where we hold. We long ago forgot we were doing it. And this is a sudden, hey, here's this thing you do every day that you don't realize you're doing. It's not comfortable always, but it can be quite ecstatic as well. Okay, so
Wow.
how do you do it? So the way I learned was you open your mouth, and that can be its own first challenge because often it's hard to open your mouth. So people who had a really hard time, you can get a Coke bottle or some water bottle and cut the bottom off just so that there's that open spout and a nice open round area, and you can just put it in here so that it forces your mouth open so you can breathe with your mouth open. You're going to do that a bunch of times and you're going to start to go, oh, my throat's tickly. I want to cough a little. It feels weird. And do that. Cough, swallow, re-moisten. You get used to it. Eventually, you just forget that it feels a little weird. So once you're used to that, you start drawing the breath in with purpose. So you're drawing it in with purpose all the way down to your belly. So you draw it down into your belly with force, and then you let it exhale relaxed. When you relax in an exhaled way, you almost cannot hear your breath at all. So I'll exhale in an unrelaxed way, and then in a relaxed way, I am exhaling the same volume of air. It's just I'm not constricting my throat or my mouth. And when it's unconstricted, it just comes right out. And you just rinse and repeat. You just keep doing that. And it becomes more comfortable over time. And once you have kind of hit a stride, a lot of times facilitators will say the breath is breathing you. Now it's just natural. Now it's just something you're doing. Some people find it helpful to do like a little jog or some dancing right before they try to breathe that way because it naturally gets you in the kind of pattern. And then they lie down and go into the breath. I'm a horrible example. I'm coughing. But when I was doing that kind of more restricted breath, you can start to see it actually does create a lot of irritation. And so that becomes the invitation to let go of the control, to let go of the muscular lockdown. And as RMTs, we kind of sometimes do the same thing depending on the technique we're doing. We're literally can be forcing your muscle to run out of energy to hold. And then once it runs out, it has no choice. It just relaxes.
I noticed when I was breathing too, I was like constricted here in the chest. It was really a challenge to get to the belly. So just even though I'm aware that that's how you're supposed to be breathing, that was my first
Yes.
go-to, right?
Well, and that's the wonderful thing about breath work is that it's got nothing to do with what you think. It's got nothing to do with rationally understanding. It really is just your body and your body's wisdom and what's stored there that isn't not necessarily rational, that isn't necessarily understandable, that might not make sense the way it is, and yet it persists, and yet there it is. Um, and the great comfort of breath work is that each breath that you inhale is a reminder, I'm still here, I'm okay. Although I am with this scary thing or sad thing or protective thing, I'm also still breathing. Each breath is a reminder that whatever it was, we survived. Not to minimize how awful some of the things that have happened to us could be, but I'm still here. It is powerful to realize I'm still here. And that's what the breath declares. Every time we inhale and exhale, I'm still here. Yes, that's true. Yes, that was awful or hard or sad. And I'm still here.
And that breath is so like when you have that strong breath too, it's like that is a great reminder because if you're holding this really shallow breath, you almost feel like you're not there. You know what I
Yeah.
mean? So,
And sometimes that's the point. Sometimes, kind of making ourselves small, really huddling up it feels really safe and probably, well, definitely was really important. It's just if we're at the point where we're investigating breath work or pain in our body, it might not be working for us anymore. It might not be serving us anymore.
so where did all this interest in breath work come from? Because I noticed this has been kind of a trend. Like I remember some lady telling me in the 90s that she went to a breath work person and lost a ton of weight. But really it seems to have come back in the last 10 years. What is that my
Yeah,
imagination?
and no. So a lot of breath work was introduced in the 60s and 70s. There were, along with the whole revolution in the way that we look at psychotherapy and the way that we look at trauma and healing. And there were a number of different teachers that were really passing it along. And then it kind of quieted down for a while. And sort of as the whole 60s movement led into the crazy 70s, it got a little quiet. And then Wim Hof came on the scene. And I think he's better known for his ice exposure, but what he came with was Wim Hof or Hof breathing. And all of a sudden, it became really popular again. The truth is, it works. And that's why it's become popular again. Um, you do need to be careful who you breathe with. And I don't mean that in any kind of like, oh, some really bad people out there. It's just, I think it's always important to have somebody who's trauma informed, trauma aware, working with you so that you're not going to places before you're ready or
Mhm.
not going to places that really aren't yours to go to. Um, Uh, and I think we're probably seeing the other side of the breathwork curve. Things are starting to get a little bit quieter. When James Nestor wrote his book called Breath, he did an interesting investigation of what breath works, what breath doesn't work, why, what seems to be going on here. Um, and I think it was really worthwhile. It was definitely time for a critical look at what works, what doesn't, what does science support. I love science. And I think research has a lot to tell us about the ways in which a thing work or the ways in which it doesn't. So I think we got really popular in the 60s, a little less popular in the 70s and 80s, and then in the early 90s started to become really popular again with Wim Hof. Yeah. Ice exposure, by the way, so awesome. It feels great and so much good research that it has a lot of depression, effects on depression and effects on our lymphatic system, and very similar to some of the effects that breathwork has. So helpful.
And amazing. So did you want to talk about your meditative journeys that you do with people?
Sure.
Yeah?
Yeah. So I hold meditation groups once a month right now in our community, and I do it for free. For me, meditation is a part of my home care. As a therapist, I want to make sure that when I show up in the room that I'm centered and calm, and I've dealt with my own stuff, or that I've reconnected with myself. So I know when I walk in that I'm really available to my patient. I'm not bringing whatever my day held in. And so when I was doing that, I found myself with patients that occasionally also needed that home care that were coming in repeatedly for stress. And so I would create some free, simple tools for them so that they could just connect with themselves when they weren't with me, so that they could calm their own nervous systems, and that would have its own relaxation effect in their body. And I thought, oh, you know what? I might as well offer this because I'm doing it anyway. And they need to do it anyway. Why don't we just do it once a month as a group, just as like a little touchstone? And I find it creates for me a tremendous amount of comfort in my back, my neck, my shoulders um, when I meditate, but it also really removes a lot of stress, worry, much like the breath. It really returns me to this remembering, like, I'm still here. Like, yes, maybe next week is uncertain, or maybe last week was hard. But right now, just right now, I'm still here. And so right now, maybe I'm okay.
Yeah.
Not that the other things are not worth grieving or worth being concerned about or taking actions to prevent if possible. But in this moment, I'm warm, I'm dry, I'm clean, I'm fed, I'm okay enough, I'm safe enough.
Well, you've always been one of the most sane people I know, Carolyn. So
I'm
you
so
take care
sorry,
of
Jen.
you take care sorry, you give out a very good impression of somebody who is very sane in many
There you
ways.
go.
Dana, do you have any questions for Carolyn?
Would like to ask a silly
Okay,
subconscious
cool.
question. And that question is, what is your favorite weather and why?
We are having my favorite weather right now where I am. It's spring, and I think I love it because you have this mix of sun with coolness. Um, and you get these really dramatic skies. It can be quite windy. You can get big cumulus clouds. And it feels like weather that's ripe with potential. It might rain, it might be sunny, or you might get both. But it never feels too hot or too cold. It never feels too dreary or too unrelentingly bright. Um, and everything is growing, and it
Mm,
smells like everything is growing.
it's so gorgeous in BC at this
Yeah,
time of year.
yeah. And our cherry blossom tree just blossomed, and it's right outside my window.
Beautiful.
And it's just like, oh, it's just like it's so life affirming. And every year we only get these cherry blossoms for maybe a week and a half, 2 weeks. And for me, they are totally a call to like enjoy what there is to be enjoyed when it's there to be enjoyed. Because, you know, it'll be completely bereft of blossoms in a week, and it'll be another year before I see them again.
Well, the other question we have for you that we ask all our guests is, what is your beyond? What is something beyond your therapeutic practice that lights you up?
I think really just being in community with people and being like just sharing, like getting to know somebody, really know them, and like what interests them, what makes them tick. Um, And I would say that, and definitely just being outside and being active, like going kayaking, biking, or hiking, like just like on a visceral level, both of those things just make me so happy.
Well, it's good you're in the right place to do those things
I
and enjoy
know,
cherry
not
blossoms.
an accident.
Well, we really appreciate you sharing your knowledge, your passion, everything today. Thank you so
My
much,
pleasure. I
and
hope it's been helpful in some small way.
we will be having you back for
Oh,
sure.
Aw, thank
absolutely.
you.
And with that, Jen, what do we always say?
Peace out.
Peace out.
See you later, guys.